Queensland had its last case of community transmission. So Queenslanders are doing an extraordinary job, so well done. But remember, if you are sick, stay at home and get tested. I've just had a briefing with the Chief Health Officer, the Health Minister and also other key representatives of the state government, and we are concerned about the cluster outbreak that we are seeing in Adelaide at the moment. And I think we wish them all the very best, and we know that they've got really good systems in place, but that does pose concern to us as large numbers of flights do come into Queensland from Adelaide. So what the Chief Health Officer has suggested to us, and we have taken that advice, is that the city of Adelaide will become a hotspot, and that will take effect from 11:59 p.m. tonight. And for those people who have arrived today, we're asking them to get tested and basically to stay where they are, because we're concerned about the outcomes of that testing. And we hope everything does go well in Adelaide, but we do need to have these directions in place, and we'll be monitoring it very closely, and the Chief Health Officer will also be attending meetings nationally about that as well. I mean, I think everyone acknowledges in Queensland we have had extraordinary success rates, and the last thing we want to see is Queenslanders having to go into any form of lockdown. All of our systems have worked extremely well, but this cluster outbreak is of concern. It's not like the cluster outbreaks we've had in Queensland, but we do really hope that Adelaide does get on top of that very, very quickly. So look, I'll hand over to Dr Young and then Yvette, and then of course Dr Young will be getting further information during the day, but we do want to give people in Adelaide that notice about that. So that's from 11:59 p.m. tonight. They will then have to go into mandatory hotel quarantine if they were coming into Queensland. And like I said, we'll be monitoring this on a daily basis. Dr Young?
So, no new cases in Queensland overnight, so we have 8 active cases in Queensland, so that is very good. The biggest issue we're now facing is this outbreak that's happened in Adelaide. So yesterday they announced that they had 4 cases, and now today that's up to 17 cases. So as a result of that, while we work out what is happening there and what we can do to manage our response to that, I have recommended that all of Adelaide, the City of Adelaide and those local government areas be made a hotspot, and as of 11:59 p.m. tonight, anyone who comes into Queensland who has been in that part of South Australia since Monday of last week will need to go into hotel quarantine for 14 days. I'm also asking that anyone who's arrived in Queensland who has been in Adelaide since Monday of last week to immediately come forward and get themselves tested and go into quarantine wherever they are. So if they're in their home here in Queensland because they're returning residents, or if they're visiting, or if they're on holidays, that they isolate themselves from other people until it's been 14 days since they left Adelaide. Now, this is important while we work out what this means. That's a very rapid increase in cases from 4 to 17, and some of those cases, I understand, have been in complex situations. One in a prison, for instance. There's been a school involved, so we need to get more information about where the risks are. But that's the situation that's happening now, so that it's really important that people who are currently in Adelaide know that if they're coming into Queensland, that they'll be going into quarantine for 14 days. Thank you.